Welcome back to another episode of Board Bitesize. Today we're joined by our Chief Executive, Jim Austin, and our Chair, Julie Holder. We have just finished February's board meeting and stepped outside to reflect on what has been discussed today, in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities, and focus on the future.
Okay, well, hello. Today it's the 6th of February, and I'm Jim Austin, and together with our chair, Julie. Say hello, Julie.
Hello.
We're just going to do a short update following our public board meeting today. It's been quite a day of meetings, actually, because we started with a subsection of the board meeting. Then we've had our full board meeting in public for a couple of hours. And then we've had a development session on the Mental Health Act, which was really, really good. Lots of learning going on there. And then another couple of hours in private afterwards. But really today, we're going to summarise a little bit around the public board meeting. And I'm going to kick off talking about the working in partnership section, where we discussed in public the Section 75 work about how we want to integrate more closely with our local authority colleagues in Derbyshire County Council. Lots of that going on in internal communications and some public engagement around that too. Some interesting questions from the public who attended the meeting, actually, asking some questions around what that would mean for them and for staff, which we answered. And as a principle, the board is, wanting to pursue that activity. We need the Derbyshire County Council Cabinet to meet. I think they're meeting next week, and then we'll get some finalisation through that over the next few weeks. But really exciting times there. And we also talked in that partnership space just around the impact that we're seeing within our workforce and our bed base following the desperately difficult acute times that have been there in the system. And I don't know, Julie, if you're going to cover on that, but I was going to hand over to you now on the next bit of the quadrant that we look at.
Yeah, well, I'm going to talk about communities, but I think you're right. You really highlighted today just how the impact in the acutes hits us as a community that little bit later on. So we really highlighted today. But I wanted to just touch on, we heard about the proposed changes to improve rehabilitation services in Babington, and actually taking that therapeutic support in people's homes. Again, our public question was a little bit around that too. It was hard for me to know whether we should talk about integrated working with Derbyshire County Council in terms of partnerships or under communities, because the benefits to our communities are going to be significant as a result of that integrated working. In our integrated performance report, we continue to highlight performance around long waits, and I think it's important. We had a lot of discussion around tier 3 weight management again, and also vasectomy, and the mitigations that we're putting in place, but also how we're escalating that to the ICB through the 25-26 planning discussions. I just wanted to pick up as well that we've heard about changes to our insight visit programmes and the quality improvement event. And I think we should just highlight the introduction of CUSA networking sessions and the development work that we read in the reports about the heart failure team. So that was really good.
Thanks, Julie. And just on those weights, we also did briefly talk about and recognise the fantastic improvement in weights we've seen in community podiatry, from a significant waiting list over 52 weeks, over 1,000 patients, to where we are today and the exit point for this year. So really recognising the hard work that's gone on there, and across the board, we are seeing some really good improvements. I'm going to talk about focus on the future next before leaving Julie with the final words. But we're obviously in the midst of the planning round. We reflected as a board how it feels better this year around the planning processes that we're engaged with. And although the national planning guidance didn't come out to the end of January, it's been very well signalled, and the team have been working very hard on what we think that's going to be. Jane Needham talked us through the plans that we've got for that and how we're engaging well across other NHS providers and more broadly on the work we need to attend to there. And the real summary of that is, the money is the money. There's not going to be lots of extra money coming in, so we're going to have to cut our cloth according to what we can afford. And there'll be a need to improve waiting times further. That's part of the national government mandate. And we'll need to work on our efficiencies. And, I sit down outside the board meeting with leaders from across the trust and more broadly than that. And I can see things really coming together. We explained to the board how we've got some sessions set up over the next few weeks to make sure that we hit the required outcome. and deliver the best possible service that we can for the money that we've got. I think there might be some difficult decisions we might come across as we get into that, but I feel very well placed. The board is very well assured, actually, on the work that's going away. So thank you to all the people that are helping with that. There was also a little bit of discussion around community health services more broadly, and that is coming into light nationally. There's some national standards that are coming out, national definitions, which we had some early sight on and been working on in the background a lot as well. And we also talked a little bit about the community transformation programme that we want to get into and some work there. So really exciting future, I think. Not an easy future, quite a tough future, but I've got some real hope about how we can get some really brilliant services up and running and reinforce the services that we've got as far as we can.
Yeah, it was a good discussion around all those things. I think it's absolutely important that we end this little piece around our people. I started our public meeting by thanking everybody within the trust, but also the system that's been coping with some really increased demand and a lot of effort and commitment to actually carry on and deliver services both within the community but also within our acutes as well. In your own report, there was a significant number of people to acknowledge today and celebrate there. Ferdy Esteban, International Community Nurse of the Year, Lynn Yates and her publication, and also Lauren Batty, who has been named as a woman to watch, which was lovely to hear. We also heard about our student nursing associates and the latest position regarding the Derbyshire Nurse Rotation Programme. Sadly, we heard there, though, that there was some risk around the funding continuing in these really difficult financial times. I think it's really important today that we give a shout out to our DCHS volunteers. There was a fantastic statistic within the reports who've contributed 5,500 hours of volunteer support since 2022. It's hard to appreciate just how much that is, but what wouldn't have been done if we hadn't have had their support. So a big thank you to them. We received our Freedom to Speak Up report and we paid attention and talked about the things that were in there. We began our public board with a staff story, so I think that's where I'm going to end, which was from Shelley. And she wrote a beautifully expressed staff story, really moved me. She was very honest and open about her experience, both in terms of her personal experience, excuse me, but the way in which we had supported her as an organisation. But she went on to talk about the difference of being a wellbeing champion is to team working, to individuals, but really what she was saying as well, how the little things make all the difference. I think that's it for me.
Yeah, an exhausting day, but very fruitful day. So thank you for taking the time to chair us through that, Julie, and I hope this little update was useful for people.
That's all for today's episode. Board Bitesize will be back after the next public board meeting.